There are three types of stem cell transplantation based on the source of stem cells. That is autologous transplantation, allogeneic transplantation, or syngeneic transplantation. Autologous transplantation, reinfusion of patient's own cells, it has no immunological conflict. The stem cells were infused as a rescue from high-dose chemotherapy. There is worry about reinfusion of cancer cells. The allogeneic transplantation, reinfusion of someone else's cells into the patient. There is minor HLA disparity. The regimen is usually aggressive and contains immunosuppression. There are complications such as GVHD and infection. The syngeneic transplantation means reinfusion of identical twin cells. The allogeneic transplantation usually indicated for younger patients. Finding a SLA-matched donor is sometimes difficult. The complications include GVHD and infection, etc. There are often chemotherapy toxicity. In terms of the donor, the allogeneic hematopoietic stem cell transplantation could be divided into the HLA-matched sibling, HLA-matched unrelated donor, HLA mismatched related donor, HLA mismatched unrelated donor. When stem cells come from a healthy donor, stem cells are clean of malignant disease, but the donor has to be carefully screened about infectious disease too. The grafts from donor bring another weapon to kill the disease. Graft versus tumor effect is a condition where donor T cells recognize recipient's tumor and build an immune reaction to systemically destroy the tumor. Allogeneic stem cells will eventually completely eradicate the patient's bone marrow and the immune system. A new bone marrow and immune system is built, all with cells from the allo donor. This process allows the elimination of the tumor, graft versus tumor, at a cost of an enormous immunosuppression and graft versus host disease. The limitations of allogeneic stem cell transplantation include the scarcity of suitable donors. Only 25% of sibling match. Not everybody has a donor. Graft versus host disease and infection, etc. The syngeneic stem cell transplantation means reinfusion of identical twin cells need to ensure twins are identical. The doctor should decide on which type of stem cell transplantation. According to the type and stage of the disease, the availability of stem cells, the age of the patient, the performance status of the patient, and the clinical condition of the patient. Patient evaluation includes the recipient age. For autologous transplantation, the age could be ranged from 0 to 70-year-old. For allogeneic transplantation, if the patient had a matched related donor, the patient range could be from 55 to 60-year-old. If the patient had mismatched or unrelated donor, the age was ranged from 50 to 55-year-old. The risk of GVHD significantly increased if the patient age exceeds 45-year-old. For dose-adjusted transplantation for older or ill patients, the reduced intensity myeloablative, non-myeloablative transplantation was indicated based on extensive pre-transplant evaluation for candidate. Patient's age could up to 70-year-old. How to select a donor? The selection of donor was based on T-cell typing of HLA antigen in allogeneic transplantation. the tissue typing is unnecessary in autologous transplantation. The preparative regimen includes chemoradiation for ablation or immune suppression. The harvest of stem cells from donors. The stem cells could be harvested from bone marrow or fluoresces from the peripheral blood. And then the stem cell infusion and post-transplantation supportive care is important for autologous transplantation and allogeneic transplantation. For autologous transplantation, it played an important role within the 100 days after transplantation. The supportive care is very important for allogeneic transplantation, even after 180 days or longer for tolerance to develop. The HLA means histocompatibility locus antigen or human leukocyte antigen, are determinants of immunologic self and non-self. It is the immunological password. It allows for effective immune response against infections and cancer. The T-cell reaction to foreign HLA molecules is a major problem of transplantation. It needs good donor and recipient match for HLA sites. It is the cause of acute rejection in organ transplantation and of GVHD in hematopoietic stem cell transplantation. The HLA locus is the most complicated locus. This is the gene map of the HLA region. The most important sites include the HLA A, B, C, and DR, DQ, and DP sites. The HLA is the most polymorphic gene. It has 128 functional genes, and 40% of which has assumed immune functions. HLA is in charge of antigen presentation. It is crucial in organ and stem cell transplantation. Before allogeneic transplantation, the family members should be typed with patients for HLA A, B, and DR sites. The likelihood of unrelated donor match was related to haplotype frequency in general population. Some HLA combinations was more frequently found among ethnic groups. This is HLA typing from one mother and father. There are only 25% chance that each sibling will match. The incidence of GVHD, if all the 6 sites was compatible, the incidence of GVHD accounts for 40%. If 5 of the 6 sites was compatible, the incidence of GVHD was about 50%. If 4 of the 6 sites was compatible, the incidence of GVHD will increase to 80%. If only half of the 6 sites were compatible, the incidence of GVHD would increase to 90%. That's the end of this part. See you later.